primarily get ear infections behind the eardrum, most dogs have an outer ear infection in the outer part of the ear and the canal. This is their eardrum. And so the infection is actually an extension of their skin. It's actually a skin infection. When it gets into affecting the eardrum is because this situation in their ear canal is so moist that the eardrum just kind of gets excessively moist and sloughs off. Unlike a human ear infection, it starts from the inside, builds up pressure, and actually causes the eardrum to rupture. We still call it a ruptured eardrum, but it's more like it just melted away. Have an exam rather than just try things over the counter or from the pet store. Oftentimes they're directing you to treat things like ear mites in dogs, which is actually really rare. It's almost always a bacterial or a yeast infection or both. Also very commonly involved is the underlying problem of your dog being allergic to either food proteins or allergens from the environment like pollen. If your dog is having an allergic reaction and they encounter those allergens, they secrete histamines in response to those allergens. And where they have a lot of histamine receptors is the lining of their ear canals, the skin in between their toes, their armpits, their groin, and then beyond that, they're just generally itchy everywhere. But some animals, their only presentation of having allergic skin disease is recurrent ear infections. So if you're not treating the underlying allergy problem, it feels like you're never going to get ahead. Every infection is a new infection, and so that's why your veterinarian can't just keep dispensing ear medications that have worked in the past, because what's growing in there now changes every time. They might still pick the same medication if that seems appropriate based on the cytology. What the veterinarian is going to do is stick a Q-tip down in, get some of the earwax, roll it out on the slide, stain it with a special stain, and look at it under the microscope and determine, are there yeast, are there bacteria, what type of bacteria are they cocci or are they rods? And in some situations, they may even recommend a bacterial culture that they send off to the lab to pick the appropriate medication for your dog. Topical medications, ear cleansers, oral medications, especially if the eardrum is not intact, they will send you with pain medication because having a ruptured eardrum can cause pain, especially when chewing. Eardrum is a barrier to the inner ear from the normal flora that grow in the dog's ear. And so if there's no barrier there, we're having to constantly fight the infection from the bloodstream. And that's why they do oral antibiotics until the eardrum has grown back. There are new products for the ear that make it easier for you to treat your dog's ear at home, and they're a gel-like infusion that we can put in the dog's ear that might last for a week or even 2 weeks in some situations, and we use that so that the product can get where it's supposed to be, last as long as it's supposed to be in there, and it doesn't matter if your pet will let you or won't let you or wiggles. And so your veterinarian may pick these one-step products where we do everything here. And then we recheck to make sure that it's resolved 100%, because if we've mostly gotten rid of the infection, but there's still just a little nugget of earwax right up against the eardrum that is persistent, it can contain really hundreds of organisms of bacteria and yeast, even in this tiny little bit that you didn't clean out all the way. We look down in there with a cone and see that it's 100% clean. If it's not, we clean it ourselves and maybe even administer some more medication and determine if we think you need to continue the medication or if it's okay to stop. So follow-up exams are really crucial to managing ear infection.